coming to you at a time of unprecedented pressure in primary care, where demand has rocketed. Demand is up 32% in my local area than pre-COVID, and that's with less workforce. And those practices who said they were fine before COVID are now struggling and can barely cope with demand. So the bottom line is we need to do something different. Demand is not going to drop. Our populations are not going to magically get healthier. And this hypertension management tool, I believe, can add some efficiencies to that. This is not a data collection tool just, it is a management tool, that's the key. So this is one example of giving us efficient savings in times. We have 3 expert speakers today. Emma from Omron, who's going to talk to you about how the product works. Ed, who's a GP from NAPC, will talk to you about the return on investment and the value proposition behind it. And Joe from NAPC will also talk to you about implementation, so the blood, sweat and tears on the front line of implementing a new digital technology. So let's start with Emma.
Thanks, Donal. So the background of where we are now, Omron have got a long-standing history in hypertension, as you'll all know, and so we know that the case for change is there. We know from talking to our customers that optimising hypertension is going to be the single intervention that's predicted to save the most for you within primary care. We also know that 50% at least of heart attacks and strokes come from people with hypertension, and we know the amount of GP appointments that are used to deal with hypertension on a daily basis. So we knew that the case was there. So what did we do about it? We've developed a platform based on the evidence. And the current developments are all based on the evidence and working with clinicians as our partners. So we looked at the 3 Tasman studies based out of Oxford and took those as the baseline. And then we've developed the Hypertension Plus platform moving forward. This has been tested by our clinicians initially and has been advocated by the National Association of Primary Care, as we've already said. And then moving forward, we're actually going further than those Tasman studies, and we're now comparing Hypertension Plus as a management tool to the monitoring or data collection aspect that was done before in those Tasman studies. And the early anecdotal results are looking favourable. So the partners that we're currently working with, because you'll be glad to know that we don't just hand you the software and allow you to implement it or encourage you to implement it on your own. We partner with you. So we currently have 7 ICBs active with a lot more in discussion, as you can see from the map. We're live in 163 practices currently and have received over 180,000 blood pressure readings during that time. 54% of the uncontrolled patients across the UK that have been onboarded have already seen a blood pressure reduction. We're moving in the right direction. We're also partnering very closely with NHS England for the BP at Home service, which Hypertension Plus complements nicely. And we've got a strong innovation pipeline moving forward for further remote patient monitoring pathways. So what does the platform actually do? I'd like to share with you now a video giving you a background to the platform.
Welcome to Hypertension Plus. Hypertension Plus is a clinical decision support tool enabling you to remotely manage and titrate your hypertensive patients more effectively. To enrol a patient in Hypertension Plus, simply send them your personal patient registration link via your choice of patient communication channel, such as email or practice text messaging service. This link is the same for all your patients and identifies you as their lead GP in the Hypertension Plus system. Lead GPs can be reassigned easily in the Manage User section of the doctor dashboard. With the unique link, patients access the Hypertension Plus welcome page, which includes an introduction to the service and a self-registration form. Please note, a patient will only be able to register via a link from your practice and validation of patient details against those held in the GP system, so patients should be reminded to use the same registration details as those on the GP system when registering to use the platform. Once a patient has self-registered, Their details are verified against their medical record and a draft profile is created in the Patient Registration tab of the doctor dashboard. To complete the profile, confirm that the entered information is correct and then create the patient's treatment plan. For the majority of patients, Hypertension Plus will recommend a plan based on NICE guidelines. Once the plan is set, the registration process is complete and patients will be invited to download the Hypertension Plus patient app. Patients use their Hypertension Plus patient app to input, track and work remotely with their GP to manage their blood pressure. The patient app sets tasks for the patient to mark off daily with automated reminder notifications. The monthly measurement week is a key part of how Hypertension Plus supports practices to monitor patients. During the measurement week, the app will prompt patients to take at least 2 readings twice a day for 7 days, providing a reliable average blood pressure for the period. The patient also completes a lifestyle questionnaire, giving practice staff more insights into their patient's health. The result of the measurement week determines any actions to be taken for the patient. For example, a recommendation to titrate an above-target patient to the next step in their medication plan. The average blood pressure value from the measurement week is stored as a SNOMED-coded entry in the patient's medical record. If, at any time, a patient records blood pressure readings that are out of limits, the patient app will prompt them to wait at least 5 minutes before taking a confirmatory reading. If still out of limits, the patient is requested to complete a short questionnaire and to contact their GP practice. An alert is added to the doctor dashboard to highlight the out of limits event. The overview screens in the doctor dashboard display patients prioritised according to outstanding actions as determined by the Hypertension Plus workflow algorithms. Clicking on a patient opens the patient details screen, where their current status, medication plan, blood pressure history and other data can be viewed. Through the doctor dashboard and patient app, Hypertension Plus helps put patients in control of their health and can support GP practices in streamlining their care pathways for hypertension.
So that was a very quick run through of what the platform is capable of. And now I'd like to hand over to Ed to let you know how the platform can be used within primary care.
Thank you, Emma. Yes, so what I wanted to do is just to talk through some of the potential use cases and where there may be some benefits for users of Hypertension Plus in primary care. So I think the first start of a journey, if you like, of a patient who may have hypertension is around case finding. And so using H Plus, it enables you to rather quite simply do a single click on board of a patient who'd like to do a blood pressure measurement week at home. So they can carry that out on a remote basis and create an average blood pressure week. And that would enable you to make a diagnosis without necessarily the footfall or the pressure upon general practice. And then it naturally links to saying, well, if this patient does have hypertension, they can move into that remote element of controlling and up titration of treatment. And I think it's particularly worth noting that the case finding element for the PCN DES is supported through the H Plus platform. So moving into the control element, then you can, once you've diagnosed a patient, you can then establish a medication titration plan, which will be recommended on, as the video highlighted, on the whole through NICE guidance. And then you can move through that automated process of patients being asked to provide their blood pressure whilst taking their medication. If their control is not yet reached, the suggestion of a step up in treatment until ultimately a patient's control is achieved. If and when there are steps that require blood or urine tests, those are prompted through the system, both to the patient and on the GP dashboard. Out of limit alerts are raised in terms of making sure that if there's a particularly high reading, that's flagged to you so you know whether to action that or not. And then we move across into monitoring. So if a patient becomes stable, whether they're onboarded as a stable hypertensive patient or whether they move to being stable, then it's a case of automated recording of the blood pressure, automated reminders for the patient to provide periodic blood pressures, which you can customize to whatever you want or you think is appropriate. They'll continue through the app to receive lifestyle advice and support about self-management, as well as medication reminders. It will help you achieve your QOF, as well as you can also use those invites and reminders in terms of QOF exemption. But I think the point I'd like to make is that there's an interplay here between that. A patient may, of course, start providing some readings that are out of control, and then they can move back into the titration step until they achieve control. So thinking about the users and what the potential benefits of using Hypertension Plus. So clearly, from a patient's perspective, it's the ability to self-manage, take ownership of managing their hypertension, support compliance around medication, I think reduce the inconvenience for patients and just give them a little bit more flexibility. Practices, there's a time-saving element through the remote elements of monitoring and also titration. It supports networked solutions, so working across a PCN to deliver a hypertension service, reducing those face-to-face visits that you may get. And I think also widening the potential roles, so using clinical pharmacists or ARS roles to support the overall management process. And I think from a population health point of view, it's really important to remember that we know that, as Emma outlined, that better control of hypertension reduces cardiovascular complications, so that mortality and morbidity associated with under-controlled hypertension, and likewise the associated health inequalities that can result. So very quickly, just really focusing on what difference did this make? Well, hopefully we're talking about that hypertension management becomes more efficient, so releasing some clinical time, automating coding of blood pressure readings, again, and ensuring QOF, DES requirements, and reducing administrative burden, driving medication titration plans through evidence-based decision making, so that you know that whoever's using the platform is following best practice, and that remote elements of titration and monitoring will reduce some of the demand of practices and promote self-management for patients. So on that note, I will hand over to Joe, who's going to talk a little bit about the learnings from implementing Hypertension Plus.
Brilliant. Thank you for that, Ed. So what I'll do is sort of take you on a journey in terms of how we implement, who it impacts. We go through a state of pre-implementation, making sure that we're prepared. We run through the strategic reporting element with you. So looking at that population health, that pathway design, which is quite significant because the pathway design leads us on to a key element, which is actually the workforce modelling. And with regards to the workforce, it's about finding the right people that you can align to each part of the process of embedding Hypertension Plus, making sure they've got the right skill set to be able to support their part of that process. And actually, the importance of doing so at the moment is really backed up by research. We know that the Health Foundation has identified that one in every 48 GP consultations highlights that there's an error in the medical records. 9% of those are attributed to medical errors specifically. So again, it goes back to Donald's point in the introduction around the importance of why we would utilise such a technology and then align the workforce. Models that we've seen, increasingly seeing as well, working particularly favourable for their patient population are those of looking at how do we max out the utilisation of those ARRS roles through an approver who perhaps has their IP qualification, can be a senior clinical pharmacist, can bring in the pharmacy techs to support their development around, how do they build titration plans. Absolutely value added in utilising care coordinators. We've seen the incorporation of digital care coordinators and social prescribers in this around how they can support patients with the non-clinical and the lifestyle changes that help patient with activation measures and more ownership. So it's a really integral part of implementation is to bring that workforce with you, to engage with them and educate them along the journey. So we absolutely support in that. Why do we do it? Well, the reason being is that it impacts the patients. Which patients does it impact? So if we give you an example here of the patients that we know, this is real world through lived experiences that we've captured and that we share with you today. We through the work that we're doing with Omron, we are definitely dispelling myths. 27% of the users on the Hypertension Plus platform to date are between the ages of 65 and 80. We're helping both patients and primary care and PCNs to adhere to that personalised care approach, because there's an offering, there's patient choice. Is this for me? Am I comfortable with technology? Do I have the blood pressure monitor? Am I not complex and therefore I don't need to come into surgery anymore? So really helping to make sure that we benefit those who absolutely should be utilising this platform. And we see a variance of what that patient population cohort looks like, as you see from the examples that are shown on your screens here. Equally as important as the people in terms of the workforce, the patients that we're onboarding, is to continually support them to work towards and to capture that patient journey, that impact. And we are building case studies, with those, as Emma mentioned, partners already looking at those that perhaps have deprivation may come into play, or language barriers may come into play, and we're working with all stakeholders to see how we can support them in overcoming that. And another area that people highlight is the digital literacy piece, and we know that 22% of the population would be classified as digitally illiterate. It's not to say that we exclude them, but actually there is a 78% that are comfortable utilising technology if we reach out to them and bring them on this journey and offer them the tools and the support in order to use it. But flows us nicely back over to Emma to share and highlight some of the success that we have had with these patients that have onboarded on this journey thus far.
Thanks, Jo. So that work that Jo's experienced on the ground of bringing the workforce and streamlining the workflows and making sure that the patients have the support that they need and what they're seeing through the app has led to some rather nice data coming out, which is taken from our internal anonymised information. So you can see there that over 9 months of patients using Hypertension Plus, we're seeing an average of 12/7 BP reduction. So that is that's an astounding number, and this continues following on. Of course, it will eventually level off, but while we've still got patients coming on board, we will still see that nice distinct reduction in BP measurements. And 56% of the patients that have been onboarded across the UK who were uncontrolled at onboarding are now controlled, which is another really powerful message that is coming out of the data. Some extra insights that have come out of the data you can see through. See there, the one that I was just reading that I wanted to pick up on is we have 1 in 3 patients are clicking through. So we're getting that continued engagement within the health promotion info and the surveys. And a couple of results from that most recent survey that we've done, which was done across 583 patients. 47% of them say that they feel more in charge of their high blood pressure. 55% of them say that they know their blood pressure readings better than they did before. And the really impactful one is 60% of hypertensive patients feel that they are better managed than they were before by their primary care, which is really powerful, a message that comes across. Now, obviously, those insights, those outcomes that we've got there being reported are going to have an effect on your workday within primary care. And this is some data that was taken from Dorset ICB of how the GP practices are managing to reduce their workload. And this is the information from this has meant that Dorset Digital have actually now expanded their service. So they started out in a small number of PCNs, and they're now seeing that it's only taking 4 minutes to onboard a patient, and 80% of the hypertensives, and they have a wide demographic, 80% of those patients are actually able to be onboarded onto the recommended plan. So the very simple click through. And they're seeing a 63% reduction in patient management costs. This is what they projected out for the first year based on their first 6 months of usage. So if that was within the first 6 months, as we've already seen with the BP reduction, that could actually potentially be more. And this is out of one GP practice, which is one of the larger ones within the ICB, but the others are all showing similar results. So we've made a nice introduction into hypertension. Where are we going to go next? From January, Hypertension Plus will be expanding out into Viso, which is a multi-condition platform. So Hypertension Plus will remain in there as it currently is, and then we're going to build on monitoring for the top 10 time-consuming conditions within primary care. So the likes of heart failure and COPD, chronic kidney disease, stroke, AF. We'll be looking at detecting changes over time from a combination of device data, so taking blood sugar readings from diabetics, weights, peak flow and saturation from your asthma patients, things like that, which will then lead us to be able to see those changes over time and to notice the deterioration between reviews, which could trigger bringing somebody in earlier, or if they're doing really well, then push their appointment out a little bit longer. There's no need to bring them in for a not needed face-to-face appointment. And then, of course, as with Hypertension Plus, the key data will be SNOMED coded to support QoF and DES. What will it actually look like? So very similar to the Hypertension Plus platform that people are already using. So we will have the validated treatment programs, which is the management. So that is the hypertension module. And then the monitoring ones, you can add in, customize, and do things as you'd like to do with them. So you can see here that we have this patient on 4 of the monitoring programs. Taking into an individual patient's dashboard, you can see there the introduction of single index monitoring, which can also be brought in as individuals or as in a monitoring plan. So you have in a one-stop shop all the information that you need, including the most recent blood results, to be able to monitor and manage your patient. Obviously, the RAG rating is still there, with important ones being right at the top for high-level weight change, as an example, in heart failure patients, or high blood pressure within your hypertensives. So now that we've had all that, I think we should hand back to the chair to follow up with some questions.
So thank you, Emma. I think on the next slide there are the common questions that are often asked, and we won't go through them all in detail, but let's pick out some of the ones that are most commonly asked or people are afraid of. So digital exclusion is a very common one. Can I pick on Joe to give us a few words on how this does not digitally exclude the elderly or other minority groups?
Yeah, absolutely, Donald. So, I mean, with regards to COVID and the pandemic, there was a huge transition to trying to monitor as best as possible patients remotely, so in their homes, and that saw a vast wave of the introduction of the BP at Home program nationally, and actually that program still exists, and it's an offering that is still there to patients as we know it. The difference between offering that and Hypertension Plus is the therapeutic tool that Hypertension Plus is, and it allows for better management and education for patients around their condition. and there are also patients that will come into surgery. Now, as part of the work that we do with the implementation is to support PCNs to look at their data, to understand it better. Are we looking at digital exclusion and making assumptions based on, common denominators of phone numbers and email addresses, or are we actually coding and asking the question in a proactive manner of our patients for all digital tools that they may be engaging on? And there are 5 SNOMED codes that practice or PCNs could start to utilise as part of this process to better understand and answer that question for themselves around the digital inclusion exclusion piece.
And just to keep you on the screen, Joe, the first question there, how many staff do I need? So, with this, it's a new technology, so do I need to have more staff on board initially, or is it that we need to stop doing something else and get them to use this technology in a new way?
Yeah, great question. So there's a sort of two-tiered approach to this. There are the direct staff who are involved, integrated, using the platform day to day, and supporting the patients as part of their management. And that could be, your social prescriber logging in, that could be your clinical pharmacist logging in. And then there are the indirect staff who are the wider workforce that we must engage and bring on that journey. The nurse, the HCA, who opportunistically may have a contact with a patient that can actually, through dialogue, perceive whether or not this is an appropriate offering for them and allow the patient to make a better informed decision. So we mustn't discount people being aware and being included in the journey and the introduction of Hypertension Plus. The aim is to pivot a lot of the capacity in the work away from primary care workforce, though.
Excellent. Ed, AccuRx and Hypertension Plus. So can you tell me the difference between a data collection service and a management service?
Sure. I think I'll say a little bit. I think maybe Emma might be able to help a little bit as well. But I think the first thing to remember is, AccuRx is more about direct messaging to capture some data. Although Hypertension Plus is able to do that, it's far more than that, because it's that ability to fully remotely manage a patient's hypertension, including the next step. So as I discussed before, it's the ability to set out a plan that if you get a reading back, it's not just about storing that data, it's then enacting a next action through the platform, through the app, to allow a patient to remotely increase their medication, continue to record their blood pressure until such time as it's under control. Emma, I don't know if there's anything else you wanted to add to that.
I think you've covered it well there, Ed. I think the only thing that I would add is to say again that it's the call and recall element. So the automation, even of patients who are on the monitoring side of the platform, they will automatically get that call when their next blood tests are required, which are obviously customizable within the platform, and the urine tests for QOF purposes, etc. And then as we move into Viso, then that will be seen even more, that there will be a cardiac health pathway, which will enable all over 40s to be onboarded onto this platform behind the NHS front door, so you won't even have to onboard them to start with. It will come through the NHS app. Direct the patients to the website, to your practice PCN website. They click through. They're already having the NHS app or the access into it, and they're already onboarded. So you've already automated very swiftly for one cost, no having to send out multiple messages week after week to try and get one BP reading out of somebody. It's all done automatically, and the call and recall is in there with the follow-up, because we do contact the patients on your behalf to ensure that those tasks have been completed.
And while you're speaking, Emma, so BP monitors. So Hypertension Plus is an Omron product, so you're going to tie us to Omron blood pressure machines?
Absolutely not, Donal. The platform is completely device agnostic. So there is no linkage at all with Omron monitors. Of course, we'd like you to use Omron monitors, and if a patient, for example, doesn't activate their system, we will actually send them an email to say, is it because you haven't got a blood pressure monitor? So we try and keep that engagement from the beginning. But if people need any more information about blood pressure monitors, I do have the contacts within the BP at Home service that I can put you in contact with their purchasing teams. There is already a purchasing solution enabled that PCNs can take advantage of. And if you don't wish to go down that route, then please do get in touch, and I can put you in contact with some of the medical distributors for our products and for others as well.
And so existing users, we had a webinar last week where we heard from a user how much he was enjoying using the product, and we asked the question of what would happen if Omron decided to pull Hypertension Plus from the market. Would her life just continue as normal? Would it be better or worse? I don't know if you want to say anything about her reply, Emma.
Her reply was very, very quick. I think it would almost be the end of the world for her if it stopped. So she is an advanced nurse practitioner who is onboarding the majority of her hypertensives and managing them. She's also now supporting our peer-to-peer national forum, and she's actually being invited to speak at conferences because of the results that she's getting with her hypertensive patients. So, I mean, she is one of many voices which are singing the praises of the platform, and they're finding multiple uses for it, uses that we didn't expect. We thought it was going to be used for hypertensives and then for case finding. We're now having preeclamptic patients monitored. We're having sports people monitored to ensure that their blood pressure is high enough. It's got so many varied uses, all from one basic platform.
And with the business case, so some PCNs are deciding just to fund it themselves because it is easier to get up and going, but others are looking to apply to the ICB for funding. So will we be able to help people put a business case forward?
Definitely. This is something that even when we start the discussions at the PCN level, we always show the projected return on investment for secondary care, looking at the heart failure admissions, the strokes that can be reduced by implementing Hypertension Plus at varying levels within your primary care setting. But definitely the first question that ICBs ask for is, are you sure this is going to work in my area? We are highly deprived, or we have a very elderly population, or we have no English speakers. So the model that's working really well at the moment that I alluded to with Dorset earlier with those results is we start off with the PCNs purchasing themselves for the first year, or for the first small period of time, to get that real world evidence on the ground for your locality, and then we take that evidence to the ICB. As yet, we've not had anybody say no, so this is a model that we know works, and we're trying to partner with you as best we can. So we're taking that primary care voice, which is currently being lost at system level, and taking it very loudly to the ICB to say, hey, we can help you here with your secondary care reductions if you spend a little bit of money back in primary care where it is really needed.
And if anyone listening to this webinar has any other questions, they can contact you, Emma, by email?
They can. Very simply, emma.line@omron.com. Yes, more than welcome.
Okay, so that brings us to the end of this webinar. I hope that this will give people some hope and some ideas about how they can get on top of the really unprecedented pressures that we are going through. This, in combination with many other efficiencies, may get you back a little bit of that lunchtime that disappeared a few years ago. So this on its own will not be the solution to your life, but I think if you start using this as a way of managing your hypertension patients, you'll suddenly start thinking of how can we deal with so many other patients in a slightly different way. Thank you for joining us this afternoon. Take care.